At this point in time, uh, the one thing that everyone in this country is obsessed with is vaccination, and rightfully so, because vaccines have emerged the only sure short way in which we can prevent the coronavirus disease, in which we can go about our normal lives without any fear of the virus. It's something that governments around the world have also recognized, because in the absence of vaccines, the only other thing that they can do, which has almost the same effect of vaccines, although not as effective, is the lockdown. And lockdowns are extremely bad for the economy, they're extremely bad for life, they're extremely bad for livelihoods, and they're also extremely bad for mental health. At this point in time, the real problem in India is not vaccine hesitancy. Uh, Vaccine hesitancy is a problem. I mean, but at this point in time, everyone wants to get vaccinated, and most people who want to get vaccinated can't find a slot on the CoWIN portal, which will enable them to go out and get vaccinated. And right now, supplies are an issue. Yesterday, at a briefing, the government laid out a plan on how it is going to boost supplies between August and December. And more importantly, and I think this is the more material decision, it decided to increase the dosage between two Covishield shots. Covishield is the Indian version of the AstraZeneca Oxford vaccine. It's made by Pune Serum Institute of India. And research around the world has shown that its efficacy is optimal when the gap between two shots is 12 weeks. We've said 12 to 16. The research clearly says in excess of 12 weeks. So 12 to 16 is permissible. Spain already does 16. What will this achieve? We must understand that at this point in time, the way supplies are coming in, 90% of Indians are getting vaccinated with Covishield. Just around 10% or so are getting vaccinated by Bharat Biotech's Covaxin. Supplies are low of Covaxin at this point in time, also of Covishield, but Covishield capacity is more than Covaxin. So right now, if you increase this gap, it means you can give more people first doses. And I think this is critical. Why is this critical? Because again, research. We have to follow science and data. There's really nothing else that we need to follow when it comes to this. Research tells us that even the first dose gives people some amount of protection against severe illnesses. How much? Around 72%. Now, is that low? Not really, right? I think in the scheme of things, between 0 and 172 is not bad. And let's remember that before Pfizer and Moderna came out with their vaccines, which have efficacies of 95%, the World Health Organization, the US FDA, as well as the drug regulators of every major country were quite willing to okay a coronavirus vaccine which had an efficacy of 50%. So if a vaccine can protect against severe illness, hospitalization perhaps, death most probably, then I think it gives people a definite shot of fighting off the virus. Second thing, it will also, although again, we have some information that tells us that when you vaccinate a lot of people, and even if the vaccine only protects against severe illness, which means you can still get infected, but you will not get a severe infection, the infections over a period of time start coming down. We are actually beginning to see this in the over 60 population in Tamil Nadu. We are beginning to see this in the over 60 population in Maharashtra. Two states which I picked because they've been severely hit by the first wave of the coronavirus disease. The second wave ravaged Maharashtra. It's just beginning to make its mark felt in Tamil Nadu. But still, this research clearly shows that when you vaccinate people over a period of time, the infections in that particular age group start coming down. So if you give more people one dose of the vaccine, which is what will happen if the gap increases, it means you can inch closer to the number of people that you really need to vaccinate. Now, what is that number? Here things start getting interesting. Vaccines in India are right now authorized for people over the age of 18. There are some studies that have begun on younger people. In the US, vaccines just got authorized for children under the age of 16 because their adult definition was 16 plus, so they were giving vaccines to people over 16. Europe has also been giving vaccines to people over the age of 16. Europe again might follow the US FDA's example and authorize vaccines for people younger than 16 very shortly. But India's population, if you break it up, people over 18 account for around 950, 960 million people. And you have to vaccinate a certain proportion of them to get what experts call herd immunity. Now, this is the proper herd immunity, the kind of herd immunity that comes from vaccination. Now, again, science tells us that this proportion needs to be around 70%. But science and mathematical models done created specifically to understand COVID also tell us that because we wear masks, because we socially distance, because governments don't allow huge events which have the potential to end up being super spreader events, at least they shouldn't. Some of them have been silly and allowed these, but ideally they shouldn't. But if you do these things, which are called non-pharmaceutical interventions, then even at a 40% level of vaccination, if you manage to give people if you manage to vaccinate 40% of your population, you will achieve some sort of herd immunity. I mean, the aim should be to get 70. The aim really should be to get to 100, but the aim should be to get to 70 optimally. But even at 40%, you will start seeing the result. And in India, that is around 375 million. So my submission is that if you vaccinate 375 million people in India with at least one dose, something that now becomes possible because you've increased the cap for Covishield, you will soon start seeing the results. You will crush the second wave, which has created havoc around the country. And you can probably avoid a third wave or make sure that the third wave is not a very significant wave. If it's unavoidable, it won't be significant, much the way that the second was. And that is what we should be aiming for. How soon can we get to 375 million? India has vaccinated fully or partially around 140 million people right now. Right? So we need to do another 235 million people. Now we must understand that you need to have a 12-week, or let's make it a 14-week rolling cycle for 90% of the people who've been vaccinated. So 90% of 140 million is around 126 million. So 126 million people have probably got Covishield. You must understand that some of them have probably got 2 shots. Most of them are likely to have got just 1 shot. Let's assume that 110 million of them have got just 1 shot. Now, this 110 million people will come back in various time periods, right? Because many of these people would have been vaccinated 6 weeks prior. Many of these people will get vaccinated now. So you need to figure out what works and see how soon you can get to the 375 million. But the key to getting to the 375 million is really to increase the number of vaccinations that you're doing in a day. Right now, we're doing just around 3 million vaccinations a day on good days. On bad days, we do a little lower. Part of this has to do with supplies. We'll have to get that bit of the equation right, and I'll come to it in a while. But at one point in time, during the first phase of the vaccination drive, the government kept repeating that it would aim for 5 million vaccinations a day. Now, of course, the process is more disaggregated. There are private sectors, there are private hospitals which are administering vaccines. There are state governments which are administering vaccines. I see no reason why the number can be more than 5 million, but let's assume that it's 5 million. So if you do 5 million vaccines in a day, and let's assume that 1 million of those go towards people who are in this rolling cycle of 12 weeks or 14 weeks or whatever it is, and 4 million end up being new vaccines. How soon can you vaccinate? The number that we had at the beginning was around 235 million. Let's make it 240 million. 4 million, 240 million, 60 days, 2 months. So 2 months from now, we are now in the middle of May. By the middle of July, we would have actually managed to vaccinate the number of people that we need to vaccinate to achieve herd immunity. As long as we continue to wear masks, as long as we continue to practice social distancing, and as long as governments are sensible and do not allow any mass spreader events